Hi, everybody. Welcome back. We're going to get started, and we're going to do workgroup report outs. Some of these report outs are going to be done on behalf of the T1D Exchange team, and others are going to be done on behalf of the co-chairs. So I want to invite Trevon to join us first for a report out on the hybrid closed-loop workgroup. I believe that we have Emily Coppage here, so she can co-present with Trevon, and I believe that Carol Levy is also joining us via Zoom, so welcome Dr. Levy as well, but I will let Emily and Trevon take it away.
Okay. I feel so short up here. So, hi guys, I'm Emily Coppage. I am one of the co-leaders of the hybrid closed loop group, and we did a rebrand this year. So we decided, we've been trying to do all these projects. It was really hard to coordinate, and we wanted to use the group as a way to be a sounding board for people to get information to do projects. So please join us, actually. But we have, it's me and Dr. Levy, and we're having guest speakers come once a month. It's Friday, Eastern Standard Time at 2 o'clock. I don't know how to compute that to other standard times. But we've been doing where we have experts come talk about off-label, like GLP-1s and hyper-closed loop. We've talked about different AIDs. We've talked about pregnancy with closed loop. So really having those like clinical discussions about how to learn more about them and manage our patients, and then bringing that to your own practices to do your own kind of QI projects with. We've really liked it, the rebrand. I don't know if anyone's been on it, but it's been so great learning, and it's been really good to pass along the conversations. So we need guest speakers. So if you have a topic, very young people, vice versa, like dementia, dealing with technology, we want that information. And like I said, it's also started really, really great email chains, people reaching out for information, needing resources, and we're all emailing back. It's a great place to have anyone in your practice join to then disseminate the information. So that's something I do. A lot of my providers have clinic on Friday afternoon, so we send the link afterwards so they can watch the Zoom or we update them. Really good for people to do presentations, if fellows want to do presentations, if they're working on anything. You can reach out to myself or Dr. Levy, or Trayvon is our QI team member. We would like you to join. So that's all we got. And then we have all these goals that it says for our next steps. But thank you.
Thank you again, Emily, for sharing. And next we have the Diabetes Distress Working Group.
Hello, I'm Melissa Roberts from Seattle Children's Hospital, and I am one of the co-leads of the Diabetes Distress Working Group, along with Devin Steenkamp from BMC. Our work group also is looking for new members. I've heard a lot of interest over the past day and a half about diabetes distress and how that relates to a lot of the work that's going on, and so clearly there's a lot of passion and interest around this project. So please consider joining our work group. We meet Friday. It's 9 a.m. Seattle time, so you can convert that to your time. But some of the things that we've been working on, so we did have some questions in the 2024 annual survey. Thank you all for responding to that. That looked at practices amongst the collaborative members around screening for diabetes distress. We are in the process of publishing that work. Jennifer Iyengar from Michigan first authored a commentary presenting that work that is just having some minor revisions before hopefully it's published in the Journal of Endocrine Practice. But what we found was that for those that responded, about only 35% of centers are screening currently for diabetes distress, so a lot of work to be done. And most commonly for adult centers, the T1DDAS is used, and for pediatric center, some version of the PAID is used. And more information about that will be in the publication in terms of other findings, but those were some of the key things that we came away with. So a lot of our work group has been around sharing ideas, sharing how we've implemented these screeners in our own practices, and hoping one of the big things we're looking forward to in 2026 is having more data, in that we are finally having diabetes distress as potentially one of the data specs. Our site, Seattle Children's, is going to, this month, kind of pilot sending that along with our other data to the T1D Exchange, and then hopefully other sites, starting with our small working group, will follow, and we can actually look at a broader sense, just like we're able to look now at depression and anxiety data, to be looking at diabetes distress data. So a lot of great work. Please join our work group. We're a lot of fun and a great group. So thanks.
Thank you, Dr. Roberts. Next, we have the Healthcare Traditions Work Group, and Timothy Ball will be sharing updates on that.
Hi, good morning, everyone. Thank you for joining us this morning. Thank you. So last year was a transitions year for our group. We lost Dr. Malik. He moved away, and we gained a new adult co-chair, and that was Dr. Jenny Iyengar. We had lots of representation from 70-plus committee members. Nearly all centers, 40-plus, represented our meetings. And we were able to put out a paper, release a new Ready Survey 2.0 tool. The link is available on our website, so if you're looking for access to that survey tool, you may feel free to reach out to me and I can provide you with that link. And on the next slide, we have the 6 core elements of healthcare transition for adults and pediatrics. Clinical areas of interest for us this past year have been transition readiness, future publications, medical devices, technology, and pregnancy. Goals for 2026 will be working on a reset for a new meeting schedule with the new committee co-chair. Clinic days don't align very well for our 2 co-chairs, so we're going to have to continue what we did last year with alternating meetings on alternating days, and hopefully that way we can cast as wide a net as possible and capture as many members as possible. So we will be sending out a doodle-type survey trying to find the best availability for all committee members, so please be on the lookout for that. We'll provide options for you to sign. You can choose your favored times, and we'll try to accommodate everyone's schedules for those meetings. And we hope to have everyone on board as possible because we are planning to initiate a new transition measure. Anton will be working closely with us. He's already on board. I've spoken with him recently. And continue with our best practice sharing, and we're looking forward to centers who will be presenting as well. So thank you, everyone, and let us know if you'd like to join. We have space. Thank you. And this is a slide of our 6 core elements of healthcare transition. This is part of a manuscript that was put out by Dr. Faisal Malik and Sarah Carruthers. So thank you all for listening. And, hi, Dr. Mamili. We're also I'm going to stay here and introduce Dr. Mamili, who's been a very active participant in our pediatric T2D work group.
Thank you.
Oh, this is the only slide we have.
Yeah, that's okay. All right, thank you. I'm here presenting on behalf of our co-chairs. I'm happy to announce, actually, the formation of a pediatric type 2 diabetes group within the T1D exchange. This has been, a great effort in the making, and I think we're still recruiting more centers. So far, we have 15 participating centers around the U.S., and we've collected a good number of data. So far, we have looked at the benchmarking non-insulin medications, baseline lipid screening, and statin use. And then we're also looking at A1C measurements and CGM use in pediatric type 2 diabetes population. When I say pediatrics, we're also including, young adults, because most of our pediatric centers continue to see young adults until, probably their mid-20s. So this is work in the making. We've had a few abstracts already in ISPAD, and then we are working on publishing some of this work and looking out for more centers to participate in this collaborative. Thank you.
So this is a special thank you for all the working groups and the co-chairs and those who are part of it. Please don't hesitate to reach out if you want to join. You can reach out to myself or any other QI staff members as well. But I did want to take a few minutes for any questions, comments on the working groups as well.